The trend is very worrying. The northeastern part of our country, New York, Connecticut, Rhode Island, etc., they are doing a good job in controlling this virus. The rest of the country, my own state of Tennessee, is not doing a good job. We are in Tennessee, not a hot spot, but we are warming up. And there are places, as Sam's piece showed, that in Miami, in Houston, parts of California, the virus is out of control because people are being careless rather than careful. So I think we're going to have to oblige people, require them to wear masks. They seem not to be doing this on a voluntary basis. And these large group meetings, we simply can't have them. That's exactly what the COVID virus enjoys. It makes it easy for the virus to be transmitted and infect other people.
Well, the president himself has said that he's opposed to a nationwide mask rule, if you will. So what would you advise these people? I mean, what is the most important thing they can do to be more careful? Is it wearing the mask?
Well, first of all, it's true we won't have a national policy, so it's up to the individual governors and mayors of large cities. In our city, we have a mask obligation. We are obliged to wear the mask. I wish every person leaving their front door in the morning in the United States, throughout the country, would wear a mask. Yeah. Absolutely.
Yeah, well, it's certainly regulated here in Singapore, that's for sure. And finally, Professor, what is your view on what we're seeing in terms of fatalities? Because it does seem as though the treatments are getting better in the hospitals. Is this encouraging, or do you still worry about areas where hospitals are getting overwhelmed?
Both of those, Nancy. Our ability to treat these patients who are seriously ill is much better than it was a few months ago. We now know more about how the virus affects the various organ systems of the body, so we can anticipate that with better supportive care. And of course, we now have several medicines, remdesivir, the steroid dexamethasone, and convalescent plasma that we are using to much better effect. More people are leaving the intensive care unit. Survival rates are improving. We're better. However, if we get a huge wave of infection, that obviously will stress the system. Healthcare workers are already stressed physically and mentally.